Diabetic retinopathy is a condition that can affect patients at any age, especially if they've had diabetes for a longer period of time, and especially if their blood sugar is uncontrolled, but it can happen even in patients who have fairly good control of their blood sugar. So to start, let's take a look at a picture of what a normal retina looks like. We have our optic nerve right here, some blood vessels. This layer of our eye is inside of the eye, and our retina is actually the layer of the eye that perceives the light and sends signals to our brain. So it's a very, very important structure inside of our eye. Now, in patients with diabetic retinopathy, the high blood sugar damages the blood vessels that are inside of our retina, and it basically makes them leaky. It makes those blood vessels leak blood and fluid into the retina. So it can cause hemorrhages in the retina and swelling of the retina. You can see if we zoom in a little bit, there's a number of hemorrhages right here that are kind of scattered throughout the retina. There is also something called exudates, which are essentially leftovers from fluid leaking into the retina and causing swelling. This patient also had something called diabetic macular edema, which essentially caused the central part of the retina to be swollen and elevated and not seeing well at all. It is very important that all diabetic patients get their eyes screened regularly. The regular recommendation for somebody with fairly good control of their blood sugar is their yearly diabetic exams. Now, for patients with actual diabetic retinopathy, very often those exams might need to be more frequent. They might need to come in every 3 or 6 months to monitor for any worsening of the bleeding and the swelling in the retina.